My name is Melody. I'm from California, cohort 39. This is my week 3 for post conference. A nursing situation I encountered this week was with a 75-year-old Persian man that was admitted status post partial gastrectomy. He has a history of bladder and gastric cancer, degenerative disc disease, and a total left nephrectomy. He was on aspiration precautions because he aspirated his vomit 2 days ago. The night nurse warned us that the patient can get agitated easily and that it would be helpful to group our assignments and medication visits. My first interaction with the patient was to administer his morning medications. As I was preparing the Protonix IV push, I explained to him what I was preparing and he asked me who I was. I told him that I was the student nurse working with his nurse. He told me he wasn't going to agree to anything without the nurse there. I told my preceptor what the patient had said. We went back into the room and she told the patient that he had to give me a chance first. The patient agreed reluctantly. Later, an upper GI was ordered and the patient was sent to imaging to receive barium contrast. After he came back, the imaging tech came to take an x-ray. As we placed the x-ray board behind the patient's back, he started yelling angrily that we woke him up and said, "It hurts, it hurts." I had to tell him that it will only take a couple of seconds for the tech to take the picture, and then we took out the board. A couple hours later, the tech came back because the contrast didn't get all the way down to the duodenum, so another picture was needed to see where the contrast was at now. The second time we placed the board under the patient's back, he yelled, "How many tests do we have?" Every time we had to go into the patient's room to give meds or do a bladder scan, the patient was very impatient and repeated the same thing. "How many tests are there?" This was a new patient to me, so our relationship was newly established. Previous experiences that have helped me provide nursing care in this situation were with previous patients that were irritable and wanted to sleep. I realized that if I am confident and firm with these types of patients, explain to them what I was doing for their care and that the doctor ordered it, patients will generally be more compliant. My role as a nurse in this situation is to administer his medications on time, have the patient get out of bed twice during my shift, and make sure he is following aspiration precautions due to his previous aspiration incident, and fall risk precautions because he just had a major surgery. At the beginning of the day, I was offended that he wouldn't allow a nursing student to provide care, but the longer I took care of him, I began to see that he had a low tolerance in general. He was very sensitive to pain when we placed the x-ray board underneath his back, most likely due to his degenerative disc disease, and he was in a lot of pain due to his major surgery. Because of his pain from surgery and disease process, he had little patience in general. What did I notice about this situation initially? Initially, I noticed that the patient was being rude to his wife that came to visit him in the morning. The wife said something in Farsi, and the patient told us to tell her not to speak. When his daughter came to visit at noontime, he also told her not to speak when she told him to stand up straight to open up his lungs. Describe what you noticed as you spent more time with the patient or family. In the afternoon, the patient's sons and nephew came to visit, and it seemed like he was in better spirits when they came. I was administering his afternoon meds and asked him to take the oral meds before taking a walk. The patient said he can take his medications after he walks. His son told him to take his meds before walking, and the patient was compliant and did not get upset. I thought some of the causes that perpetuated the situation was the pain from the patient's illness and surgical incision, and it seemed to me that the patient does not have respect for women. Whenever a woman, his wife, his daughters, or my preceptor and me would ask him to do something, he would be very upset and agitated. But when his sons and nephew came in the afternoon, he did not have the same attitude with them. I have never encountered a similar situation like this before. I've only dealt with agitated patients, but never ones that were openly disrespectful to women. My preceptor helped me by always being in the room when I was providing care because she knew the patient needed the assurance of a senior nurse in the room. My goal for the patient was to enforce aspiration precautions, administer medications on time, and to allow adequate rest for the patient as requested. My nursing response was to be confident when completing tasks with the patient so the patient did not get even more agitated. Stresses that were experienced was having to deal with the patient's agitation for around-the-clock care. The patient had around-the-clock medication and upper GI tests and needed to ambulate at least twice a day during my shift, so having the patient respond in a negative way every time I entered the room was very discouraging.